όπου έχουμε για μία χρονιά ακόμα τον πολύ καλό μας φίλο και συνεργάτη, τον κ. Flynn, ο οποίος είναι ο ιδιωτικός διευθυντής του Κέντρου Ελιάς του Πανεπιστημίου της Καλιφόρνια, ο οποίος θα μας μεταφέρει το πνεύμα της Αμερικής. Να δούμε λίγο τι έχει προκύψει την τελευταία χρονιά σχετικά με τις καταναλωτικές συνήθειες στην Αμερική και τα θέματα διατροφής και υγείας. Οπότε, Mr. Flynn, you're welcome.
Thank you. This is my 9th Olympia award, so I hope to keep the streak alive. So I got involved with UC Davis 20 years ago, and what set me on that path was tasting a really fresh, high phenolic olive oil, and it was so different from what I had had previously, where in the United States we had a lot of not so good quality olive oil. So that's what I think really led me here today, is just tasting a good olive oil for the first time. And it's been a great journey for me, and I know that a lot of people who are in this field are interested perhaps in exploring the possibility of selling into the United States. So I wanted to provide for you a bit of information about that. You know, when I started 20 years ago, I was always fascinated at how much olive oil was consumed in these countries in Europe. You know, something like 15 liters a year in Spain, maybe 18 liters a year per capita in Italy, and I believe it was something like 24 or so liters a year in Greece, and it was just mind-boggling because in the United States the per capita consumption was more like 750 grams. But because we're a large country with a big population, that adds up, and the United States back then was the third largest buyer of olive oil in the world, the largest importer and the third largest consumer, okay? So when I was thinking about presenting today for you, I wanted to look and see how those consumption patterns have changed since then. And so I crunched some numbers for the International Olive Council, and here's what I found, is that in the traditionally producing countries, the consumption was down fairly significant over the last 20 years. As you can see here, Spain 43%, Italy 47%. I understand it's down even in Greece, but Greece is unique in terms of how it buys olive oil, and basically a lot of it is just produced within the family. So these statistics that I get from the IOC, I don't know that really would be applicable given the unique situation that Greece is in. But then you look at the countries that are big importers of olive oil, and consumption is up. And in the United States it's 41%, Brazil 264%, and Germany 94%. And I could have added a few others here. Japan is up a great deal, Australia, other places like that. So what we have now is a situation where consumption per capita is declining in the traditional consuming countries, and it's on the rise in those countries that may not even produce olive oil, but are in some way attracted to it by its flavor profile, health properties, or whatever. And so now that the United States is second in the world in terms of its consumption of olive oil, in terms of the you know, global or big figure, the mega figure, per capita consumption is up as well, or instead of 750 grams, it's more like 1,060 grams. But still a big market. So in getting some information for this presentation, and I've drawn from this group before, it's the International Food Information Council. Every year they do a study, it's a survey, and this one had 3,000 consumers, and they look at the buying patterns of groceries, and they look at the interaction of those buying patterns and attitudes toward food and health. So this is a study that just came out a week ago, and so it's all fresh, pretty fresh data. And so if it's hard for you to see some of these figures, depending on where you are in the room, don't worry about it. You can look at the results yourself. It's all online. So one of the things that's good is the United States believes generally that olive oil is the healthiest fat for cooking, healthiest fat or oil for cooking. They asked the participants in the survey to pick your top three. And so you can see there olive oil, avocado oil, and canola oil. Olive oil has had some issues with the concerns about authenticity and adulteration, but my former colleague, and I'm retired from UC Davis now, my former colleague who was a leader in a number of the studies that we did, including on olive oil, she a few years ago did a study on avocado oil and found that of the 23 samples that she analyzed, she and her team analyzed, 90% of them were either adulterated or rancid. So olive oil is not in anywhere near that bad a shape when you compare it to avocado oil. It's interesting to break it down by different demographics on this attitude of olive oil being the healthiest oil. And you can see in this chart that women in particular believe that to be true, as well as people over the age of 45. As you get older, you're more concerned about your health, and you're paying attention a little bit more to the news about health and diet. There's variability among these different demographic groups, but generally it's a strong majority that believe that olive oil is the healthiest fat or oil. Interestingly, though, some of the lowest rates are among those who are under 45 who believe this. And so maybe there needs to be some more education with that demographic, but I don't know exactly what else is behind these numbers. So taste is the top driver of purchasing for people, not just with olive oil, but for food. And price is in the second position, and then healthfulness is in the third position here. Each of these with strong majorities, and you can see that over more than a 14, 15-year period, those positions have more or less stayed the same. So taste, price, and healthfulness. But if you look at it and break this down by income, that the higher income groups rank healthfulness above the price concern. And that starts at about $100,000 in the U.S. terms per household income. So that's interesting as well to sort of see behind the number that income is one of the factors if people believe that healthfulness is going to be behind their purchasing decisions. Looking at online purchasing of groceries, I almost never buy food online. I don't know, I don't suppose people do in Greece too much, but 23% do it at least once a week in this survey. This is from last year's survey. They didn't cover this question this year. Whereas about 2/3 of the participants in the study do in-person shopping each week, at least once a week. So I found that interesting. When you look behind that number a little bit, the younger population, so I don't know if we have these generational names here in Greece or not, but Gen Z would be people born after 1995. They are in fairly high amounts buying groceries online, as well as the millennials, the generation above them. The boomers, who are from 1945 to 64, born in those years, at the lowest level on this purchasing. So something to think about is if you're aiming at certain demographics to try to increase your sales. In terms of what people are seeking in terms of benefits from their food, energy and less fatigue ranks the highest in this survey. But next up is healthy aging, which increased from last year, and weight loss or weight management. But if you go down this list, you can see a lot of the things that we hear a lot at the Olympia Awards in terms of the benefits of oleocanthal and olive oil in terms of health. So heart and cardiovascular health, brain function, the metabolic health, lowering inflammation, diabetes management. So there are segments of the population that, when they're looking at the benefits from food, are talking about the very same things that the research here that is being sponsored or in some way promoted by the World Olive Center for Health. There's a very consistent symmetry between those concerns. And then where people are getting food and nutrition content on social media. So social media has become such a big source for information for people of all ages. And in this survey, they found that Facebook and YouTube were particularly strong in that regard, but also particularly strong with the older populations, would be Facebook and YouTube. Younger populations are looking more at Instagram and TikTok for their information about food and health. And then in terms of who people trust for food and health information, this was reassuring to me in a lot of ways that the conversation with their personal healthcare professional was at the top rank. And some years ago, when I looked at this study, it was also in the top rank. And the next step would be a conversation with a registered dietitian. So people are looking for people with expertise for information about food and health, on which foods to eat and which to avoid. Ranked at the bottom, which I also was reassured by, was social media influencers or bloggers, because you see so much bad information on social media, and particularly with olive oil. You see just, every time I read an article about olive oil, I feel like I need to send a comment in to set them straight. And I think some of the worst offenders in that regard would be these influencers or bloggers. So, just to sum up here, the U.S. market is growing. The U.S. is the second largest buyer of olive oil and consumer of olive oil in the world. They're the largest importer. And who knows, I mean, maybe the United States, even though we don't consume a lot per capita, maybe the United States is going to be the top consumer of olive oil in 5, 10, 20 years. Large majorities consider olive oil the healthiest fat or oil for cooking, which is certainly on your side here. People who are older than 45 and higher income rank healthfulness over other values. So that's also something to keep in mind when you're targeting. And a significant percentage of people buy their groceries online, especially younger people and parents with children at home who are under 18 years of age. And then dietitians, healthcare professionals are among the most trusted people for this information on food and health. So, I mean, with all this information out there, it isn't necessarily going to be, yes, it's a big market in the United States, but it's not necessarily an easy market to penetrate. There are examples here in the room of people who have successfully done that, and maybe you should seek them out to see what they would share with you in terms of the challenges involved with it. And that's kind of beyond my expertise, but I hope that you'll find a way to continue to do the work that you're doing and producing this high phenolic olive oil. I think Greece is leading the world in this respect. And if anybody asks me what my view is, when I come to Greece, I would say, agapo tin adlata.